Welcome back to my YouTube channel. Today we will discuss about the normal menstrual cycle and certain new terminologies. First, you should know what is normal menstrual cycle. We will describe normal menstrual cycle under following four subcharacteristics. The first is frequency of cycle. It is given from 24 to 38 days. Next is under duration of flow. Normal is between 4.5 to 8 days. Third is volume of blood loss, between 5 to 80 ml. Fourth is regularity. Normal is between 2 to 20 days. If the frequency of menses is less than 24 days, we will call it as frequent cycles. If it is more than 38 days, then we will label as infrequent cycle. If the duration is less than 4.5 days, we will call it as shortened cycles. If it is more than 8 days, we will call it as prolonged cycles. If the volume is less than 5 ml, it is known as light bleeding. If it is more than 80 ml, it is known as heavy bleeding. Coming to regularity, if the cycle to cycle variation is between 2 to 20 days, call it as regular cycles. Absence of menses as amenorrhea. And if the regularity is not between 2 to 20 days, we'll call as irregular cycles. So these are the new names which is given by Figo and is adopted by Foxy. These new terminologies were given by Figo, which is being adopted by Foxy. So the new terminologies include frequent cycles, infrequent cycles, shortened cycle, prolonged cycle, light bleeding, heavy bleeding, irregular cycles, amenorrhea, and regular cycles. The older terminologies for frequent cycle is polymenorrhea, and infrequent cycle is oligomenorrhea. Short and light cycle, we'll call it as hypomenorrhea. Prolonged and heavy bleeding, we'll call it as menorrhagia. These are the older terminologies which we followed in the past. There are certain other terminologies which is heavy menstrual bleeding, intermenstrual bleeding, and breakthrough bleeding. Let's define these three. Heavy menstrual bleeding is defined as excessive bleeding which interferes with physical, mental, social quality of life for women is known as heavy menstrual bleeding. If the volume is more than 80 ml or if the duration of blood flow is more than 8 days, passage of clots, changes pad during night time. All these comes under heavy menstrual bleeding. Now let's define intermenstrual bleeding. Intermenstrual bleeding is defined as light, short, irregular episodes of bleeding in between a normal cycle is known as intermenstrual bleeding. Breakthrough bleeding is defined as unscheduled bleeding in patients on estrogen alone or estrogen plus progesterone therapy. Here we should note that this does not include bleeding, basically cyclical bleeding following progesterone withdrawal or cyclical estrogen plus progesterone therapy. So these are the normal menstrual cycle pattern and the new terminologies which we should be followed. Thank you.